Okay, we just had our lunch. Your group was so good. We just had some great barbecue ribs, or not ribs, but barbecue food from Slaps, just so you know, in Kansas City. So we're on the other side of the lunch break, and we're fortunate enough to have Jeff give his time again to us to talk about something that I think I'm desperate to know, and I know other people are, is insofar as physical therapy or supplementation physical therapy, what's safe to do with FSH? Weight training, aerobic training, low intensity, high intensity, resistive to exhaustion. Jeff's going to help us understand what they've been seeing insofar as, what's a safe and healthy practice to do in the context of a muscular dystrophy, specifically FSH. So Jeff, I'm really anxious to have this kind of conversation.
Sure. Well, so the first thing I always say to people is that, in the setting of an inherited disease, in this case of muscle, that tends to slowly progress over time, small interventions can have a really large effect. So I start there. So there's always a sense that some people get, they say, well, I'm not going to do anything because, I have this thing, it's changing over time, so what good is it going to do? It can do a lot of good. And so I start with that.
Mm-hmm.
There's an old dogma that was for people with muscle disease, you don't do exercise. Somehow we're going to damage or hurt the muscles. So I'd start here with that one. I don't think that's true. And in FSHD, we have studies to help inform us to understand this. And so when we think about exercise, as you already mentioned, there's different kinds. There's aerobic exercise, and it can be mild or it can be intense, and then there's what we typically think of as resistive training. That's like working out with weights. In aerobic exercise, there have been a number of studies in FSHD that have shown, one, that it's safe to do, and in fact there were some early studies where they really were asking just this question if high intensity aerobic exercise would somehow damage the muscle. And it doesn't appear to damage the muscle, and for periods of time up to, say, 6 months, which is as long as those studies really went, it appeared safe to do it. People improved in their aerobic capacity. So if you're doing aerobic exercise, you'd want to know, am I going to improve in my aerobic capacity? And yeah, people appeared to improve their aerobic capacity. It's good for your heart. It's good for your cardiovascular system. As far as strength, it's a little harder to know whether it's going to have a definite effect on strength, but I think that it probably has a pretty strong effect on well-being, because when we're active and doing things, we tend to feel better, especially for people if they're having some problems with pain or discomfort. And so in my clinic, PT is a very strong part of what I do. Everyone who comes in will hear this from me, because I always ask them, what are you doing? What physical activity are you doing? Because I think it's important for a multiplicity of reasons, for mental health, physical health, cardiovascular health, to be doing something. One of the types of exercises that I like a lot for people if they're really not doing much to start with, and so some people are very active and some people are less active, is to start with water therapy. And this isn't necessarily swimming where you're going to have trouble with your shoulders, but what it does is the water helps support your weight some. Especially if you're starting to have problems with your legs, and it gives you just that little bit of support, so now you can exercise legs where otherwise you feel very unstable, because it's supporting some of your weight. And it's a nice even resistance through your range of motion that you're moving, the water itself. And then some people just like being able to be in the water. This can be at a Y, it can be at a special facility where they have just a slow ramp to get into the pool, so it's safer depending on what you can and can't do. But you're also people, you can do aerobic training. So you can do this in a gym, you can do it at home, you can use a bicycle to do it, whatever your means of wanting to do it are going to be. Most of the modern exercise equipment can give you an idea of the intensity level by monitoring your heart rate. Yeah, and so you can gauge your strategies based on that. And so for aerobic training, I'd say it's probably doing some versus none is a benefit. You can do high intensity and get the aerobic benefit, and it doesn't appear that people got worse. So like I said, for doing it as long as 6 months. So
like a recumbent bike. is good, you know, and you can push it and go through those programs like
That's
a 45
right.
minutes.
That's exactly right. The intensity will have to do with the program. How long you're up at that really steep hill on the
Right.
program is
Exactly.
will make it high intensity or not. And now resistance training, that's a slightly different one because of course you're now loading weight on, and so what I'd say is if you want to do resistance, you can certainly work with bands. Bands have a certain advantage to them because you can tend to feel your body out as you're working with them, right? And you'll be able to tell when you're starting to put too much tension on it. Or with a free weight or something, sometimes you can overload it unintentionally. But we have had a study of resistance training in FSHD as well, where they were having people push the amount of weight that they could do. And they did this fairly intense program for 6 months, and then they continued it for a whole year, but they added albuterol in the second part of that study. I think what I'd say is for the muscles that they specifically trained with the resistance training, they didn't get stronger. But I think the other side of that, which is a question I get, is it going to make you worse? And they didn't get worse either. So what I tell people is it's probably safe to do it. What I would suggest is just a little bit of caution in how you approach it. If you have a joint where you're having trouble, like the shoulder, for example, for many people, or for some individuals it may be their knee, you don't want to overload a joint where you're having a lot of weakness, mainly because of my concern for the joint.
Right.
Yeah, and so you can still exercise around those joints, but you'll be careful when you're doing that. Now, for other areas, you may have a pretty normal muscle strength, and you can go ahead and increase the resistance. And what I usually say is just start, maybe not like we did when you were 20, if you go in the gym and you just keep loading on the weights. Instead, you'll take a lower weight and you'll increase the repetitions.
Right. So you're not really going for hypertrophy, like really big, heavy weight exhaustion. More like for stamina and low weight.
But you can increase the weight, but I just say don't be in a real hurry. So go a little slower to make sure. Now your body's going to give you some feedback on this.
Sure.
If you do an exercise and you're just wiped out for a week and you're really sore, well, you probably overdid it. You need to start scaling back.
Right. And here's something I tried, and we're going to touch on this a little bit too. Supplementations, at least natural. And we had a little earlier discussion, hopefully we'll just touch on that a little bit. I've seen some things where there's supplementation, weight, or aerobic. But I know putting things together, it multivariate, makes it harder to determine, well, what. But in my case, I understand, I'm trying to see whatever I can do to work. And if I put yes votes in for muscle formation as you build, almost like what a bodybuilder would do, or somebody who's cross-training, I can't imagine how that can't be good within reason, to the body. What I'm trying to do is, and we started doing this because I did it for about 6 months, and I really had no log in what I was doing. Okay, well, how do we get like you're doing? What are repeatable clinical measures or efficacy measures, whatever you want to use the term, to show yes we're making progress or we're not making progress over time? And what I'm starting to do is when we train, take a measurement of my muscle areas. You can see, like, I think you were talking about the distal, right? So I'm getting like a Popeye arm here, right? So you can see this area seems to be just the same with my knee, which I showed you, which you really can't see maybe, but the atrophy is starting from the knee, right? But the quads here seem pretty good. But this is the area when we were talking about where that knee lock or where I fall. When I fall, I have trouble breaking 90 degrees. I can only get up. I can't get further up.
The rest of the way, sure.
And when I fell today, this burned and stayed burned for a good hour, and both of them hurt. So some of the exercises that I tried at this one club that we're starting to go to, there is a leg press, but it's horizontal, slightly angled, so you're not working against gravity or with a ball against the wall. So I can push and lie down and only put 10 pounds on.
Right.
So I'm not trying to push my weight against gravity.
Right.
And I felt that's a relatively mild thing to do.
Sure.
As you can see, if you don't mind me showing you a little bit, I got this, and this is probably because of core weakness, right? So I'm starting to lose my core. You can see my tibialis. I mean, I don't have to show it, but the typical winging.
Yeah.
So my serratus is gone. I got my pectoralis underdeveloped. But other than that, this seems to be good. The TAs are obviously underdeveloped.
Right.
I can't do a foot
Sure.
drop. But my calves seem to be good. I mean, there are other muscles, whether they're actually being involved in the disease process and yet are not showing, or whether they're healthy. Weight training or aerobic can help tone all those additionals for compensatory purposes, right? They compensate.
So I often talk about that, and if you work with a physical therapist, they can help you with that. So this would be, learning to move with the, the pattern of weakness and strength that you have, and so you do it safely, but also so you can do things more efficiently, and it makes it easier to move.
Right.
If you haven't worked with a skilled physical therapist in a long time, it's worth going back and doing a course once again, because this is where they're often very good. They can watch how you do things and make simple recommendations that may make it easier for you to do it. In terms of, how do you know if you're getting better or worse, which is one of the classic questions I get. You're starting a supplement or you're starting an exercise program and you go, well, how do I know if it's helping or not? Well, I usually tell people you've got to pick a few things that you're going to follow, because that's the only way you're going to know how you're doing. And I'd say one of them should be more of a personal experience thing. Maybe you want to get some questions that would be related to having pain or fatigue, or how much activity you're doing. And so you might start with that, and so you can see, well, did I maybe start having less pain, or was I having more energy once I started it? And you could track that. You can use something like the activity feature that's common on most modern phones, but also on the watches most people have now. And just track that. You can track your activities levels. They also track things like your heart rate. And you can see if your actual amount of activity is going up once you've started your intervention. And then you can look at specific things. If you're looking at your muscle, you can measure the strength, or you can measure the number of repetitions that you're doing. If you're doing something that's more aerobic, you might measure the distance that you're going.
Yes.
Right. And these would all be things that you can follow over time. And like I said, I think your goal would be sort of a slow but steady improvement.
Right. One of the things I thought about modifying, again, just doing this by the seat of my pants, Jeff, but if normal, like one goes Monday, Wednesday, Friday, to just do weight training. Maybe I'm thinking if DUX4 appears, when does DUX4 appear? Does it appear the following day during differentiation? So normally your recovery period, the DUX4 is not necessarily expressing as you're exercising, right? But as the muscles begin to differentiate, as if it's trying to rebuild, as you recover, is that when it's present? And then if that's the case, and if in some of these tissues the DUX4 is appearing and so on and so forth, would it make sense to, instead doing it every other day, let 2 days of recovery, because maybe there is a little bit of water that's getting bailed out, or in some of those, even if it's on a strand basis within a muscle, and just giving your muscle a little bit more time to recover. Could that help? A variation of
So I think you need to be adaptable. The broader question you're asking about what's going on at a molecular level, no one really knows it. And it's a good question, but unfortunately it's very difficult to actually know that. But I think your other point is sort of the common sense of doing it. Absolutely, you want to adjust it. The goal here is something that's sustainable, right? So we're not looking for the quick change, we're looking for something you can build into your lifestyle that you can sustain over time.
Right.
And so you're absolutely right. If doing it 3 times a week was too much, then you can see if you can do it 2 times a week. And if you do it for a while, maybe you'll get back to where you can do it 3 times a week.
Right.
But I think that there's another side to this, and we've seen it now in a couple studies in different diseases, which is it's not even just exercise that you can do as an intervention. The Dutch did a study recently of something called cognitive behavioral therapy. So these are behavioral adaptations to our lives, and it's a formal type of therapy you can get, but the general tenet to it is to try to identify those areas in your thinking on a day-to-day level where you're putting up barriers for yourself and teaching yourself to change your habits to sort of break down those barriers, the barriers you have doing activities or to being social. And even doing something like that can have a pretty remarkable effect, certainly on fatigue and pain. But in that study, it even seemed to have a effect on looking at the appearance of the muscles on MRI. And so you could say that little interventions may have a big result in something
Sure.
like FSHD. So I think that, I think it's definitely worth trying something, and if you just haven't been doing it for a long time, you can go ahead and see your doctor and have them help you develop a plan.
Right, and and exercise and proper nutrition goes hand in hand, I think, with helping with osteopenia or osteoporosis. Right, there's that. Isn't that, since this is skeletal muscle tissue?
Yeah, the
tends
bones
to be
and the muscles talk a lot. Now, I mean, I think in FSHD, Dr. Wagner and her group actually did a nice study looking at the bone mineral density, and it
Yep.
was pretty normal in FSHD, but I think the general concern in a muscle disease is that what keeps your bones healthy is putting weight on them, and so as people get weakness, they tend to stop putting as much load on the bones, and that would tend to potentially decrease the bone mineral density. But I think that you're right, proper nutrition and trying to stay active, these are all things that would help with that.
Right, and that for me, for somebody who falls or other people, if that's not a good combination of having weak, brittle bones and the propensities to fall, because I heard at least Dr. Wagner at one point said 50% of people who have serious fall injuries can be wheelchair bound by that. So that's a scary prospect. So fighting while you can, so to speak, to help minimize, getting a DEXA scan, getting your calcium and D3 supplement under the guidance of a particular doctor or a physical therapist or somebody like yourself. Actually is quite broad in that respect. The challenge is, where do you find these individuals that can really do that?
I think also some sort of a restorative yoga class is good.
I have a lot of people who do yoga, they like it a
The
lot.
stretch,
Yeah.
the mild class is a lot of the stretching of the body and being in a certain position for a short amount of time, breathing, and just relaxing the mind.
Right.
I think would be very helpful too. I think Robert's fears that he can't get up once he's on the floor.
Anymore now.
Right, and
It's-
so,
it's-
that's hard. In those situations, what you need is you need to just plan ahead. So you need to have either people there with you who can help you, right? Or you'll have to figure out what the strategy would be, or you're going to have to do the stretching in a different situation. In this
Yeah,
case,
and I think
it's
it's funny you say that, because my hamstrings are contracted, I think, just by the nature of how I'm starting to walk. So I'm really actually tight here, and that's just what happens. But is there a registry or a certification? This is what I'd also like to see, because I go to PT
Right.
in the context of recovering from some other thing, but not in the context of an underlying neuromuscular disorder. Is there a place that one can go in their area, wherever you are in the country? Because Jeff's here in Kansas City. Not everybody is fortunate enough to be here. He can only take on so many patients anyway. But where could you
always
find
happy to
people?
see new patients.
Okay, there you go. So, and for those in the Midwest,
Yeah.
there you go.
Right.
But is there a place to, a registry, so to speak? And if not, or can the FSH, or could we help get together a group, so people who are looking for PT, because I'm trying to
You mean a
find.
physical therapist who specializes
Exactly.
in people's
Exactly.
muscle disease? Yeah, is what I would say is that's a good question, but unfortunately I don't know that the resource exists yet. Now, in your local area, you can always go to your MDA clinic and see if the physician there has a physical therapist they're working with who has particular expertise in the area. But I think you're right. I mean, the other thing to do is you can get a group of people together between you as a network.
Yeah.
A lot of you will have seen, probably some of you may have seen multiple physical therapists, and if you see someone you like who's doing what you think is a particularly good job, word of mouth is a great way to share that resource.
Well, here's another idea,
Network.
and we can do this another time. However, would you like to do, or would you be, again, if you say no, we can leave this out.
Yeah.
But would it be helpful to possibly come up with a syllabus of some sort, a training syllabus, whether through PowerPoint presentation or a combination of, and do a training video yourself for
Yeah.
people who are already
I
skilled in
think, I
PT?
think this could be good. What I would say is I think the FSH Societies has a lot of interest in this, and I know Friends of FSH are also likely interested. I would say it's worth probably trying to get some experts together to do that. It takes the person to do it. So we have with our network and my project manager who you've met today, we're taking on some of this, and we're going to try to help promote and create some resources for people. But there's always more work to do, and so I think I told you early on that I see things as a collaboration. And so what I would say is if you wanted to collaborate with us to help get this resource
We'd
out
love
for
to do it.
people, we're absolutely happy to do that.
Okay.
Yeah.
So look for that, because we're gonna follow up and do that,
Yeah.
so. Okay, is there anything else we can touch on, or are we pretty
No, I
much
think
covered it
that's
for
good.
now?
I just thank you for coming.
Oh,
It's been
thank
a
you
pleasure
for-
meeting both of you. Yeah.
And stay tuned, and again, if you like, share. There's a lot of people out here probably that have it, you don't even maybe know that they have it, and just know there are a lot of resources like Jeff and his team here that are working on great outcomes for us, so. Thanks, take care, we'll see you soon.